and welcome back to Knee TV. I'm Dr. Adam Rosen. I've had a lot of my patients recently ask about cobalt and other metals that may be in total joint replacements after watching a documentary on Netflix. I'm going to try to answer some of those questions today. Now, when we talk about cobalt in total hip replacements, what most surgeons are most concerned about is what's called the bearing surface. So in a typical total hip replacement, there's four main parts. You have a stem, which is attached to a ball, which can be made of either metal or ceramic. There's a metal shell, which goes inside the pelvis, and inside that goes a plastic liner. You can occasionally fix the cup with additional screws, which would be another part, which are also made of metal. Now, when we in orthopedics are talking about metal-on-metal failures and hip replacements, what we're actually referring to is the bearing surface, where this would be a metal head on the inside of a metal liner. And what has happened in this patient is as they rub back and forth, this generates metal debris, which is typically made of cobalt and chromium. Whereas in the plastic insert, as the person walks and wears, the debris that gets generated is plastic debris. Now the head can be also made of metal, and in that case you have the metal head rubbing on the plastic liner. But the area that we've seen the biggest problems is where the actual bearing itself is made of metal, and as they walk and move, that has led to failures that we haven't seen as quickly and as severely in the other types of hip replacements. Now in knee replacements, there's also metal, and typically the problems that we feel may be causing some people's pain is the nickel. Most total knee replacements have four main parts. There's typically a thigh bone part, which is made most commonly of cobalt chrome. There's a shin bone part, which is made of either cobalt chrome or titanium, depending on the company, and then a plastic insert in between. Sometimes the back of the kneecap will be resurfaced with another plastic button. So as you bend and straighten the knee, it's the plastic button that rubs on the metal. So in this, different from the hip replacement, which is metal on metal, the things like the plastic liner in a hip is what can wear is the metal on the plastic, and this can lead to some plastic debris. Now there are a couple companies out there now which have special surface coatings, and the idea behind these surface coatings is to limit or prevent the amount of cobalt or chromium or nickel which can leach into the knee joint and may be a cause of symptoms in some patients. So in this is a titanium coating, and what has happened is they've coated the entire back and the front of the metal with this surface technology. So as you bend and straighten, there's still plastic debris that can be generated, but it prevents the cobalt chromium on the shin bone or the thigh bone part from touching the bone or the tissue. Now currently a lot of my patients have questions, and can they have a joint replacement without metal? And at this point in time in the United States, we do not have a total hip or total knee replacement that contains no metal. And the difficult thing for us is we're still not 100% sure in knees as to what the main cause of those pains may be. About 15 to 20% of people with what we would describe as a successful total knee replacement, meaning that the knee is well aligned, well balanced, well sized, but the patient still has pain. We still may not have answers at this point as to why. You always have to rule out things such as infection or muscle or ligament problems. But there may be some concerns with more typically the nickel, but possibly the cobalt. Patients can be sent out to allergists, but even most of the allergists that I've talked to still don't have a firm answer as to whether or not a skin reaction, such as if you have reactions from jewelry on your wrist or your ears, if that person is also at risk of having the same type of pain problem and reaction inside their knee. So although this may not give you the perfect answer or solution to all of your questions, hopefully this sheds some light on the things that we're looking into and the things that we're dealing with currently with total hip replacements and total knee replacements. Thank you for watching. I'm Dr. Adam Rosen.